Yeah, my name's Glenn Gradine. I'm from Calgary, Canada, and I just had a right hip replacement. I probably first noticed it approximately a year or so ago that there was some impingement in the hip and had some x-rays done, and my doc in Calgary had said, at some point you're probably going to need a hip replacement. But really no pain until last weekend in February. I was skiing and got this incredibly sharp pain. So I really haven't had a lot of pain for a long time, but it's deteriorated very, very quickly. So from the last weekend in February through the month of March, I progressed from walking and skiing normally to virtually being unable to walk, and I couldn't sleep at night. So in a matter of 4 weeks, it fell apart really. I saw a doc there, an orthopedic surgeon there in the middle of March. His prognosis was the earliest they could get me in for a hip replacement was August, and there's no way I was going to make it to August like that. And that's when I started researching alternatives in the US. I came across Rick Baker, who's an associate of Dr. Kassman's. Spoke to Rick. Between Rick and Dr. Kassman, they got me a couple of references, people that I could talk to, previous patients to speak to, which I did do. And it started me on the path of researching different procedures, anterior procedure, posterior, lateral, and minimally invasive posterior, which is what Dr. Kassman does. And at the end of the day, you can see pluses and minuses, advantages to each procedure. But my feeling was that either the minimally invasive posterior or the anterior would be best for me. I'm an active guy and I want to recover quickly if I possibly can, and those seem to be the two best for quick recovery. I decided by about the 1st of April I had to do something, I had to do it quickly. So I was working on dates when I could have it done. Dr. Kassman was actually pretty flexible on that. I flew down here on the afternoon of the 15th of April after a board meeting and met up with Dr. Kassman and the assistants here on the 16th. They did x-rays, all the pre-op stuff they needed to do on the 16th, and then on the 17th at 7 o'clock in the morning I had the hip replaced. The surgical hospital where Dr. Kassman works out of is they just do surgeries. There's no other sick people in the hospital. So that was a deciding factor too, just the simple fact that I was going to a place where it was designed and functionally just for joint replacement and joint repair. I think the surgery itself only took less than 2 hours, but I was awake before noon and I was walking by 2 o'clock in the afternoon with a walker. And I used a walker on Friday afternoon, Saturday, Sunday. By Sunday afternoon, I was fine with a cane, and and they give you a very detailed schedule. They say 2 or 3 nights in the hospital. Well, I was 1 night in the hospital. They say 4 or 5 days with the walker. I was 2.5 days with the walker, and then they say probably a couple of weeks with the cane. I was done with the cane after 5 days. I don't need a cane now. And I was using a cane before the operation. So it was pretty fast.
And can't really perceive that he could have recovered more rapidly with some other technology. Went home the day after surgery, probably could have gone home the day of surgery if he was so inclined. Had discontinued use of a cane by, I think, 2 days after surgery.
Well, they have a very good physiotherapist. His name is Scott. He's been over to see us every day or every second day at the house. We started doing walks in the morning, so we'll walk for anywhere from 30 minutes to an hour and a half. We'll go for a little walk. And then the physiotherapy, the series of exercises, that's what I've been doing, and it's just every day. By Wednesday, I was at a point where I didn't feel I needed a cane anymore. I'm thinking sort of 6 to 12 months based on what they've told me as I should be fully functional. I think things like cycling, I think I'll be way ahead of the curve on that. But my plan is to be skiing again next November, December. I started this process. I first felt the pain about February 28th real bad and made the decision on basically April 1st, and here it is, April 17th I had the operation, and what is the date today, the 24th, and I'm feeling, I'm basically back to be able to walk and talk and act like a normal human being. I mean, it's been such a positive, it's been so much easier than I thought it was going to be.